I am so excited to announce my newest baby, a book for parents all about tongue tie. Tongue Tie for Parents is the book you need if you have any questions about whether there's a tongue tie, how to get treatment, if your baby needs treatment, how to go about it, how to make decisions, how to help you and your baby recover. All of that is in this ebook. Every day I get questions from parents like you, and I know you need answers. Tongue Tie for Parents is built from the same step-by-step protocol I use when families sit across from me in my office. It's the information that you need for clarity, for confidence, and to help you make care decisions based on your own goals, because that's what's most important. You shouldn't need a Google search to get answers. You aren't crazy or overreacting. You are trying to figure out what is best for you and your baby. It's here and ready for you. Tongue Tie for Parents is an easy download. You can have it today for only $27. Go to tonguetieexperts.net/parentbook or follow the link in the show notes, because you and your baby deserve clarity, not confusion. Welcome to the season marking 4 years of the Tongue Tie Experts podcast. I'm incredibly grateful for what this space has become. What started as a simple idea to create thoughtful, evidence-based, and multidisciplinary conversations about tongue tie, infant feeding, and airway-centered care has grown into a global community of professionals who are committed to doing better for babies and families. Over the years, I've had the honor of sitting down with parents, lactation consultants, dentists, birth and medical professionals, therapists, researchers, and educators from around the world. Together, we've explored the science, the controversy, the clinical nuance, and the very real human stories that live at the heart of this work. My hope has always been that this podcast supports you in thinking critically, collaborating confidently, caring more deeply, and helping more people. If you're new here, welcome. I'm so grateful that you found us. To those of you who have been listening, sharing episodes, and sending messages over the years, thank you. Your support is the reason this podcast continues to grow. To our guests and sponsors, special thanks to you for your incredible contribution to this mission. Let's see how long we can keep this going. Please click, follow, leave a rating or review, and share with a colleague. It truly helps this podcast reach more who need to hear these insights. Now, let's get into today's episode. Hi, everyone, and welcome back to this week's episode of the Tongue Tie Experts podcast. If you're new here, I'm Lisa Paladino, registered nurse, certified nurse midwife, IBCLC, and founder of Tongue Tie Experts, where we talk about the real clinical, functional, and emotional aspects of caring for babies with oral restrictions and the families who love them. Today's episode was inspired by a conversation that started with a social media post from a well-respected colleague, and I'm sharing this with her permission. And what followed was a flood of thoughtful responses from IBCLCs, speech-language pathologists, release providers, therapists, and even a parent. So this is not about one provider. This is not about one case. This is about a pattern that many of us see. And it's time we talk about it. And I think that in my platform, I have been talking about this, but maybe I don't come out and say it. So today I'm going to come out and say it. This post described a text received late at night from a parent. And it said, "My baby just had a tongue and lip tie procedure done. We've never been able to breastfeed. We're both frustrated. How soon can I see you?" Like, wow. So they've never been able to breastfeed and they had a procedure and they expect everything to magically just work. I wish it was that easy, but if you work in lactation or feeding, you've probably received this message. Maybe not at 11 o'clock at night, but often it is at night when we get these emergency frantic messages. And I always feel bad for that family because they've been misguided, and we'll talk about that. It's not the family's fault. A family they were told that the procedure would help them breastfeed. They expected feeding to improve, and instead they are overwhelmed, discouraged, and unsure what went wrong because the baby isn't just automatically breastfeeding now. So here is the clinical truth we need to say clearly. I'm going to say it clearly and then I can't get the words out. A frenotomy releases tissue. Let me say that again. A frenotomy releases tissue. It does not teach a baby how to feed. Feeding is not anatomy alone. You hear me say this all the time. It's not what it looks like, it's how it functions. Feeding is neuromotor coordination, reflex integration, postural stability, maternal physiology, regulation of the nervous system, practice within a dyad. One comment said it perfectly. When oral motor patterns, posture, breathing, and function aren't addressed first, the restriction may be released, but the dysfunction remains. And when dysfunction remains, families assume the procedure failed, when in reality, the process is what failed. The process was incomplete. What's important and encouraging is that many providers who perform releases agree. Several shared that they require lactation involvement before babies even get on their schedule for release. One provider said, parents sometimes get frustrated when I recommend therapy first, but they come back later saying, now I understand why. Another noted, a release does not guarantee a proper latch if a comprehensive assessment wasn't done first. This is not a divide between professions. This is actually a shared recognition that team-based care produces better outcomes. And if we step back a little, this idea isn't unique to tongue-tie care. It's how we approach function everywhere else in healthcare. We wouldn't place a cast and then skip the follow-up to make sure movement and strength return. We wouldn't prescribe glasses without checking the prescription and teaching someone how to use them. We wouldn't send someone home with a breast pump and assume they automatically know how to build a milk supply, although maybe that happens sometimes. And we certainly wouldn't correct structure and assume behavior, coordination, and adaptation will just organize themselves. Yet sometimes in infant feeding, we expect exactly that. We release tissue and hope function catches up. But babies don't learn to feed by procedure. They learn through support, practice, neuromotor organization, and guided care within the parent-baby dyad. Yet with infants, we sometimes jump to procedure before preparation. This understanding that feeding is functional, relational, and developmental is really the heart of why tongue-tie experts exists. It's the framework I teach inside the Professional's Guide to Tongue-Tie in the Breastfeeding Infant, where we walk clinicians through assessment, clinical reasoning, collaborative planning, not just identification of a frenum. And it's why I wrote Tongue Tie for Parents, to help families understand this, that this is a process, not a quick fix, and not to give unrealistic expectations, and to give them the tools to advocate for comprehensive care. Because when everyone understands the sequence, assess, support function, prepare the dyad, intervene when appropriate, and then guide recovery outcomes change. Not because we did more procedures, but because we delivered better care. We must protect the family's experience. When families aren't prepared, several things can happen. Feeding does not improve immediately. Parents feel they did something wrong. They're handed exercises without context. They lack follow-up guidance. Their stress skyrockets. One professional shared seeing parents with real emotional distress because they weren't supported through the process. Many clinicians see children years later with persistent issues, not because the release was wrong, but because the functional work never happened. This is where we as healthcare professionals must slow down. Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today. The discussion on this Facebook page also raised a hard question. Who is making sure, or who is responsible for making sure families understand the process? Some argued that parents are responsible for advocating and researching on their own. Others emphasized that informed consent from the professional must include explaining the full continuum of care. The truth is, it's not either or. Healthcare works best when professionals guide with clarity. Families are supported in understanding. Decisions are shared, not rushed. But overwhelmed new parents cannot be expected to navigate fragmented care alone. That is why teamwork and coordination matters. Collaboration is not just saying follow up with lactation. It means assessment before considering release, stabilizing feeding first, preparing the dyad for the change that's going to occur, having clear expectations about recovery, having hands-on follow-up after the procedure, and communication between providers. If you're in my course and this sounds familiar to you, this sounds just like the handouts I have. The education packet for parents is all of these things, plus more. But that's why I have all these things in place for you to teach your families. In this group, one commentator summarized it beautifully. Procedures appeal to us because they are tangible, but feeding is a process. Yes, exactly. So where are we headed with all this? We are starting to see more emphasis included in professional guidelines on interdisciplinary care, functional assessment, and appropriate follow-up. Not because releases are wrong, but because isolated care is wrong. The science is moving us toward integration. Now our systems need to catch up. So what does this mean for us? If you are a release provider, you hold enormous power to shape a feeding relationship. Referrals before and after are not optional. They are essential. If you are an IBCLC, SLP, OT, PT, or body worker, your work is not adjunct. It is foundational. If you are a pediatric provider, helping families understand the sequence of care can change outcomes dramatically. And if you are a pediatric provider, you must have more of a network than sending to the release provider. You must network with these other professionals who understand function and will be able to assess properly, guide the families, and then consider release. If you're a parent listening, you deserve preparation, support, and a team, not just a procedure. So, where do we go from here? We don't solve this by arguing about whether releases are good or bad. That's not the real question. The real question is, are we supporting function with the same level of intention that we address structure? When we slow down, when we assess thoroughly, when we prepare families, when we collaborate across disciplines, when we guide babies through learning new movement patterns, that's when we see the outcomes everyone wants. Better feeding, less parental distress, more lasting results. This is the model of care we've been working to build through the tongue-tie experts. Not centered on procedures, but on understanding the entire feeding relationship, equipping both professionals and parents to move through it thoughtfully. It's what I teach clinicians inside the Professional's Guide. It's what I try to translate for families in the book Tongue Tie for Parents. And it's what conversations like this are meant to keep moving forward. Because babies don't need isolated interventions. Families need coordinated care. And when we provide that, we don't just change latch scores or feeding plans. We protect the early relationship between parent and child. That's the work. Thank you for being here and being a part of a community that is willing to think deeply, collaborate openly, and keep learning. If this episode sparked ideas for you, consider sharing it with a colleague in a different discipline than yours. That's how real change starts. And as always, thank you for the work you do supporting babies and families every day. I'll see you next time on the Tongue Tie Experts podcast. Have you ever found yourself thinking, do I actually know enough about tongue tie to assess this baby, to talk to this family, to know what should happen next? If you've ever had these thoughts, our newest program, the Confident IBCLC, was created with you in mind. And it's open to anyone who works with babies and families. You don't have to be an IBCLC. This is a 1-hour live, low-cost, high-impact training for anyone working with babies and families who wants more clarity, stronger clinical reasoning, and more confidence around tongue tie and feeding concerns. This masterclass is here to quiet that imposter syndrome that's been whispering in your ear and to remind you that you are capable, qualified, and needed. You can sign up right now at tonguetieexperts.net The direct link will be in the show notes.